The sudden death of a local basketball star, Mike Babel, was the head coach at Thayer Academy. Only 47 years old when he died Monday from a heart attack.
Only 47. His twin brother says that an autopsy has revealed, and I'm quoting here, undetected heart disease. Joining us now is Dr. Naveen Kapoor, an interventional cardiologist at Tufts Medical Center. Doctor, first of all, Happy New Year. Second of all, and I will say this, and you can say yes or no. You did not treat Mike Babel, right? He was not a patient of yours, right?
That's correct.
Okay, but I undoubtedly, because I have, you've heard stories like this before. Relatively young guy, active, athletic, by all counts, very healthy. Suddenly his heart stops. Is there really no warning?
Yeah, this is really, first of all, a very sad case that we do see not uncommonly. And you're absolutely right. There are certain warning signs that can be evident in most cases where patients may have symptoms such as chest pain, palpitations, they may feel lightheaded, or they may have been followed by a doctor for things like high blood pressure, diabetes, or cholesterol, or they have smoking or other alcohol use that may lead to heart disease. But in cases like this, a young, otherwise young, healthy, active person who has sudden death, there are some important things to recognize. One is that this may not be detected. It may occur spontaneously. It is fairly rare for this to occur, but over the age of 35, usually the causes are related to blocked arteries in the heart that can cause a heart attack. But in some of these cases, we find that there is no blocked artery. And when that occurs, in about 2/3 of those patients, there is undetected heart disease present, which means they may have had weakened heart muscle, valve disease, an infection of the heart, something that otherwise wasn't quite typical. And that's more likely in this case, especially when you hear the diagnosis, undetected heart disease.
Which is scary when you
Right.
think about it. What type of conditions, doctor, are hard to detect?
Yeah, so there are a number of inherited conditions where you may have a thickened heart muscle. There are conditions where you may have weakened heart muscle and you don't know it. Those symptoms can be quite subtle. There are certainly infections that can lead to an infection of the heart, and that may also be symptoms that you think are related to a cold. And so you may not know that you have a weak heart. And usually those will present with difficulty breathing, those palpitations we talked about, sometimes with chest pain, but those are not typical for a heart attack. And then, of course, there's always the concern for athletes who are young to have sudden cardiac death, which means that they have a spontaneous arrhythmia.
Right.
You may hear some famous cases where that occurs.
Yeah.
That's also quite rare. So that's in about 1 to 6 out of 100,000 subjects would experience something like that.
Doctor, certainly you see some patients with clear risk factors, such as obesity and smoking. You were just mentioning them a couple seconds ago. So what else gets your attention?
Yeah, what I tell my patients is to really just try to be acutely aware of their symptoms. So obviously, there's going to be things in their history they need to be aware of. If you have a family history of sudden heart attack or sudden cardiac death, or a history of heart weakness in the family, those are things that should trigger an evaluation early on, if you're not already cared for by a cardiologist. But I think the other things to be acutely aware of are your activity levels. One of the best things is just basically going for a walk every day. And when you start to do that, you're giving yourself your own intrinsic stress test. And so if you start to feel symptoms when you're otherwise doing your daily activities, that should be a trigger for concern that makes you go get evaluated by a cardiologist. So I think I would say keep an eye on your risk factors, try to reduce reversible risk factors like smoking, et cetera. Get checked in with a primary cardiologist or a primary care physician to get evaluated for your cholesterol levels. These are all really important steps for taking care of yourself. And then become acutely aware of your symptoms and try to maintain good activity levels where you're kind of pushing yourself a little bit with those daily walks and keeping an eye to make sure nothing is different than it was the week before.
Excellent information. Good conversation, Dr. Kapoor. Thank you so much. We appreciate it.
Thank you, doctor.
Thanks so much.
Take care.